My name is Emily Pace. I'm the Director of Pelvic Health with East Tennessee Spine and Sports location The Nest. I'm originally from Knoxville, and I've been with East Tennessee Spine and Sports since 2017.
My name is Taryn Bader. I am a pelvic floor physical therapist. I'm located at The Nest. I have been with East Tennessee Spine and Sport since 2022, and I am originally from New York State.
My name is Kayla Beats. I'm a pelvic health physical therapist at the Fountain City location. I have been with East Tennessee Spine and Sport since 2018, so for the past 5 years, and I have been born and raised here in Knoxville, Tennessee.
I'm Amanda Carden McKinley. I'm the pelvic health physical therapist at our West Knoxville location. I started there 5 years ago in 2018, and I was born and raised in Knoxville, Tennessee.
My name is Kelsey Hornick. I am a pelvic floor physical therapist in Lenoir City. I am from Oak Ridge, Tennessee, so pretty close to home here. And I started at the company in August of 2021.
My name is Rachel Smith, and I'm a pelvic floor physical therapist at The Nest. I've been here since October of 2022, and I'm originally from Memphis, Tennessee.
The Nest is a safe space to get treatment for pelvic floor dysfunction. We recognize that it can sometimes be very scary to show up at a place and not be sure what kind of privacy you're going to have walking into a bigger gym. So we created The Nest so that you walk in and you know everyone who's here is also being seen for pelvic floor issues. We treat all genders, we treat all ages, and we really hope to create this safe space for folks in all walks in life.
The services that we provide would include any dysfunction that involves your urinary system, reproductive systems, and bowel systems. It also encompasses pregnancy and postpartum care and includes pain that might be associated with your low back, your pelvis, your abdominal region, and even your hips.
This specialty clinic is needed in East Tennessee because you can throw a rock and hit a PT clinic. There are not enough of us serving the general population in Knoxville or East Tennessee, and as we grow and as we continue to support our promise of excellence to the area, we want that to show up in our pelvic floor clinic too.
I think it's important to have this type of specialty clinic anywhere where there are people, and it's a wonderful opportunity for the people of Knoxville and East Tennessee to experience a clinic that is dedicated to their safety and their care.
On the very first visit, our patients come in and they fill out paperwork. We will then come and grab our patients and take them back to our private treatment room, in which case we will have a very in-depth conversation so that way we can really get to know what our patients' symptoms are and what we can do to help them.
After we've gathered your history, we'll spend more time assessing your back, your hips, your core, and your pelvic floor. The pelvic floor muscle assessment can be internal or external based on your comfort level.
From there, depending on what we find, we will send you home with home exercises to get started on, and then we will get you scheduled for your next visit and we will progress those accordingly.
The evaluation process for a pelvic floor problem is not significantly different than the evaluation for an orthopedic problem. We're going to sit down, we're going to have a conversation, we're going to find out where you're at, how long your symptoms have been going on for, and where you want to end up. Our assessment will look like a very similar evaluation to if you had a back problem, a hip problem, or a knee problem. The one different component is that we have the skill set to take a look at your pelvic floor. These muscles go from your pubic bone back to your tailbone, and so we can assess those muscles fully externally, or sometimes we might need to do an internal evaluation. All that will be discussed and fully to your comfort, and we won't do anything that you are not comfortable doing that day.
Often we have the question, how long is this going to take? So that depends on a lot of variables. It depends on how long the problem has been present for, what your lifestyle is like, what your work life is like, what your physical activity level is. Generally speaking, it can be anywhere from about 6 to 12 weeks depending on your condition. Sometimes with urinary conditions, we're seeing full recovery in about 4 to 6 weeks, but with more chronic pain conditions, we might have the patient with us for 12 weeks or longer. Again, it just depends on the chronicity of the problem and the other factors we need to consider when continuing your care.
And generally speaking, you should see improvement in your symptoms in 2 to 3 weeks. It may not be perfect, you may not be to 100%, but you should start seeing changes pretty quickly with care.
I treat a lot of common conditions in my clinic, and by common conditions I mean incontinence. It doesn't just have to happen because you're getting older, it can happen from a lot of other things. I treat constipation, I treat pain during pregnancy, postpartum women, as well as just general pelvic pain. My favorite conditions to work with are probably the postpartum population. I really like getting them back to doing the things that they love. And I really enjoy troubleshooting the urinary incontinence side of things, urinary frequency, things like that, because it does involve a lifestyle approach.
Some of the common conditions I treat are urinary incontinence, fecal incontinence, constipation, pelvic pain, pregnancy-related issues, and postpartum patients. My favorite conditions to treat typically are postpartum patients or pelvic pain patients.
The big thing that I think makes our program stand out from other programs in the area is that we take a very individualized approach. We don't take a set of protocols and run patients through them. We take a very individualized approach. We want to make sure that we're helping you meet your individualized goals and start from where you're at and get you where you want to be. Additionally, we have taken a really big effort to make sure that we are spaced evenly across the greater Knoxville area and East Tennessee to make sure that we are caring for patients in a way that doesn't make them drive an hour to come to treatment. The harder it is to get into care, the harder it is for you to get these symptoms resolved.
East Tennessee Spine and Sport is dedicated to staff development and progress. So you will find your therapists are up to date on the most recent literature and evidence-based practice. We are dedicated to our own professional development so that you as a patient are receiving the best, most up-to-date and individualized care that we can give you.